Good afternoon, and thank you all for being here today. I know that it was just announced that the University of Florida is scheduled to play at Ole Miss on September the 26th, and that Mississippi State is scheduled to play at LSU on the same day. But what I know in our state is a lot of people are very interested in college football happening, and I'm very interested in college football happening. So if you ask yourself, what is the one thing that we can do to help ensure that that occurs? And what I would say to you is keep doing what you're doing. Wear a mask. Stay socially distanced. Do not get in large groups for social reasons. Do the little things right now so that we can do the big things later. We know that Mississippi is coming together to beat back the coronavirus spread that ravaged our state this summer. Thank you. We know that your efforts are working. Whether you're a Rebel or a Bulldog or a Golden Eagle or a Jackson State Tiger or any other of our universities, or whether you just want to go out and root for a high school team, understand that you can make a difference. The way you make a difference and ensure that we can move back towards a more normal fall is by making sure that we take the numbers that we're seeing this week and the numbers that we saw last week and push the gas pedal all the way down. Let's work together to continue to slow the spread. On July the 29th, our 7-day average peaked at approximately 1,390 cases. Today, our trailing 7-day average is below 700 cases. It didn't just happen. I've seen some say, well, it's just because that's the nature of the way this works. No. The virus spreads until we can do the little things to mitigate further spread. That's what's happening in Mississippi. We've seen 3 consecutive weeks of positive movement. The question is, can we be disciplined enough as individuals, at least for the next 2 weeks, to drive it down even further? And then we can talk about what can we do in the fall to keep it down. But we're not where we need to be yet. We've cut it in half. That's good. Let's be happy. But let's not rest on our laurels as we did in June. Because what I can tell you for sure is that if we let it turn around, it will turn around. If we let down our guard, the number of cases in the community will go up. Let's continue to drive down cases in the community, and that's going to help us ensure that our kids stay in school. It's going to help ensure that we can do things like sports and other extracurricular activities that matter to those many, many Mississippians across our state. I also want you to know that today, as we work to ensure that children can achieve quality learning in the state of Mississippi, we are going to announce 2 measures to increase access to health care and COVID-19 prevention in our schools. First, we are expanding school-based emergency telehealth coverage throughout the state of Mississippi. This will allow schools, even those without school nurses or school-based clinics, to access telehealth services. A physician, a nurse practitioner, or physician assistant will be able to provide remote services in schools across the state. This is a program that originated from the Mississippi Division of Medicaid, and many of you have seen Drew Snyder, our very capable director of the Division of Medicaid, over the last several months, and I've asked him to come today to share some more details with us about this program. Drew, thank you for being here, and the program is yours.
Thank you very much, Governor. Since the beginning of the COVID-19 outbreak in Mississippi, Governor Reeves has made it a priority to leverage telehealth services as much as possible to increase access to health care while limiting unnecessary travel and potential exposure. Under flexibilities granted by the Centers for Medicare and Medicaid Services, the governor announced in March that the Division of Medicaid was extending its coverage of telehealth services in a number of ways, which included allowing beneficiaries to access telemedicine from their homes. With the new school year beginning, we have now enhanced access to school-based telehealth coverage for as many as 270,000 Medicaid beneficiaries by allowing any school to serve as a temporary originating site for a telehealth visit. Traditionally, telehealth services are delivered by a Medicaid provider located at a distant site to a beneficiary located at an originating site, such as a local doctor's office, with a telepresenter who facilitates the encounter. DOM's telehealth policy already allowed a school-based clinic staffed by a physician, nurse practitioner, or physician assistant to serve as an originating site for a Medicaid beneficiary in need of services beyond the range of the clinic. However, many schools across the state do not have a school-based clinic or a full-time nurse on staff. With this change to the Division of Medicaid's emergency telehealth policy, any school can serve as the originating site as long as a telepresenter is present for the encounter between the beneficiary and the distant site healthcare provider. Telepresenters can include registered nurses employed by a school district or staff employed by a community clinic. This allows those community providers to build connections with their local schools and supply telepresenters as the need arises. Our hope is that this new policy will increase the likelihood that children can get more timely and efficient care without having to leave the school and without creating additional burdens on parents or the schools themselves. We believe this will also promote the safety of healthcare workers by allowing them to deliver more services virtually. The change took place August 1st and will remain in effect throughout the duration of the public health emergency. I appreciate the collaboration and support we received from the Mississippi Rural Health Association and the Department of Education in making this change possible. And I'd also like to thank Governor Reeves for making access to telehealth services a key part of the state's response to the COVID-19 pandemic. As an agency, the Division of Medicaid has been focused on improving access to needed services, and this new policy aims to make it easier and safer for those in our classrooms to get the care that they need.
Thank you, Drew. We really appreciate all of your efforts. One of the things that we've tried to highlight over the last 6 months is as we attack this virus and we deal with the repercussions of the spread of the virus, is the innovative ways that our state agencies are going about dealing with the new challenges that we face. This is just yet another example of Drew and his team being innovative, doing everything in their control and power under our direction to make sure that we provide these services for the students who need them. We also know that testing can allow us to help prevent the spread of the virus by immediately identifying and isolating known cases. As teachers return to the classroom, we want to make it as simple as possible for them to get access to testing. Dr. Dobbs and I have met numerous times over the last week or so with respect to this, and while we all know that we cannot fling the doors wide open on testing requirements for all because of the limits of primarily the national private testing labs, we can provide more flexibility for our teachers to provide peace of mind and confidence that they are COVID-free. Starting this week, teachers will be allowed to receive tests administered by our public health lab even if they do not exhibit symptoms and have not been in close contact with a known case. There will be several avenues for that we will be rolling out in the coming days and weeks, and Dr. Dobbs will provide more details on those. But I do believe that this increased access to testing and telehealth will help ensure that our schools can remain safe and education can occur in the state of Mississippi. Remember, when it comes to the reopening of schools, as Dr. Redfield with the CDC said, the question is of public health versus public health. We know that there are risks with opening schools, and we know that there are risks if we choose not to open schools. So our job, once we have decided to do everything we can to safely reopen schools, is to then administer and find programs to mitigate risk as much as possible. Dr. Dobbs?
Thank you, Governor. I'll go ahead and start off talking about some of the details of the teacher testing as it will become available. There'll be multiple mechanisms through which this testing will be available to teachers and faculty K through 12. Of course, the testing clinic on West Street will be available. We also will use our community testing sites that we have active, 2 sites across the state every day. But in addition, we're going to have 16 testing teams regionally throughout the state, and they're going to rotate at the county health departments and do drive-through testing that will be available on an ongoing manner. It should be beginning next week. As we have more details of this, we will make sure that we post it and available so that teachers have and other faculty members have all the details that they need to make sure they can get tested when they need to get tested. Jumping over to the numbers, we have 276 new cases reported today and 11 additional deaths. I would like to just state this is a remarkable opportunity that if we make the right decisions and really focus on limiting transmission at this moment, we can have an entirely different trajectory than we might otherwise. If we let our guard down, and we do have some challenges going into the next few weeks with schools opening up, because we are seeing exposures happening within the schools, and with colleges especially, and many of you may have been monitoring some of the activity in colleges. We've seen massive, parties that violate the rules as they are, and there are going to be outbreaks in those scenarios. So we have some real opportunities. We also have some real threats. And certainly we'll be working closely with all partners to see what we can do about that. But I encourage everyone to please double down, mask up, maintain your distance, avoid groups, and if you have kids in college, tell them to stay home and stay in small groups, because we're going to have some real trouble out of that, I have no doubt. If we're jumping over to our school numbers as far as cases and quarantine, we will have finalized reports on every Monday. We're still onboarding schools. We have 220 something reporting schools today, but a lot of them haven't really opened up yet. So there's still sort of other work to do to make sure we get the full range of schools. And obviously some are still virtual, so they wouldn't be sending in information. But of the reporting schools, we have 71 counties that have reported cases within a school system. Again, that doesn't mean they caught it there. Most likely they brought it with them when they were going to school that they caught from the community. Among teachers, we have reported a total of 245 cases, and among students, 199. If we look at the numbers of those that are under quarantine, among teachers we have 589 that are under quarantine at present and 2,035 students thus far. We'll continue to update this information and work with our schools to make sure that all of the processes are working smoothly. The last thing I would like to mention is flu season's coming up, and we don't want to have a bad combination flu season and COVID season. So please get your flu shot. We know pharmacies are starting to stock the flu vaccine now, so I would encourage everyone to go ahead, go out, get the flu vaccine, especially the people who don't think they need the flu vaccine. Everybody needs the flu vaccine. If you're young and healthy and are not worried about the flu, get the flu vaccine. We have young people who die from the flu every year, but we certainly don't want to have flu and COVID at the same time, not only making people sicker, but also too overwhelming our health system, which is already stretched as tight as it can be stretched. Governor, that's all I have. Thank you.
Thank you, Dr. Dobbs. Today, I also have before us House Bill 1806 from the session that occurred early last week. I am going to sign this bill into law today. Just to remind everyone, back in late June, early July, the Mississippi Legislature passed an education appropriation bill. I made a decision because the school recognition program was not funded in that particular bill to veto parts of it so as to ensure that we raised awareness of this school recognition program. And in effect, what it does is it pays teachers, some 23,157 of them, an additional $28 million because they worked together as a team to either ensure that their school was an A-rated school, a B-rated school, or that they were in a school that improved a letter grade. And so every single school district had teachers that are eligible for this particular payment. There were schools right here in the city of Jackson, for instance, that went from an F to a D or from a D to a C, and we reward those teachers for that great work. Since this program has been implemented, we have seen a trajectory of more and more of our schools getting rated A and B. And I think that is a testament to the fact that when we reward success, whether it's on the athletic playing field or whether it's in the classroom, that success begets success. And I want to thank all of the teachers who reached out to their legislators to ensure that these 23,157 teachers would in fact receive this $28,020,972. The legislature funded it last week, and I am signing the bill into law right this second. It is August the 17th, 2020, 2:48 p.m., and House Bill 1806 is law. Congratulations to all of our teachers, and while I know we're going to have exceptionally challenging times over the next year, ensuring that we continue on our upward trajectory, as so many of our classrooms and so many of our schools and so many of our districts are operating under hybrid plans and otherwise, the fact is Mississippi's educational attainment level is on the rise. It was on the rise before COVID, and it can continue to be on the rise if we all commit to make sure that we are doing the little things to give our kids an opportunity for success. Because I believe that in Mississippi, we can compete with anyone, anywhere in the world. We just got to do our part to give everyone that opportunity. And I am proud of the successes that have been made, and I'm most proud of the text messages and the social media posts I get from moms and dads around this state over the last couple of weeks saying, I know that the decisions with respect to schools are extremely hard, but I just want you to know that both of my kids went to school today for the first day, and when they came home, they had the biggest smile on their face, perhaps a bigger smile than I've seen them have since March. I know we've got challenges. I know we're going to have to quarantine teachers. I know we're going to have to quarantine students. And in fact, I would tell you, the mere fact that we are quarantining shows that in many of these districts, they're doing the right thing. They're doing the things that need to be done. I would be much more concerned and much more worried if we came here today in week 4 for some schools like Corinth and you told me there were 0 kids quarantined. Because we know that the community spread 2 weeks ago and 3 weeks ago and 4 weeks ago was significant and obviously significantly higher than it is today. The challenges continue to exist. We will continue to have challenges. We've got to work together as a state, whether you're a Republican or a Democrat or an independent, whether you're a Bulldog or a Rebel or a Golden Eagle or a Jackson State Tiger or someone else, an Alcorn State Brave, you name it, we got to work together. A Millsaps Major, Belhaven Blazers. It's whatever you are, you just let us know you work with us and we can make a huge, huge, huge difference. With that, I'll turn it over to questions. Scott?
Governor, back to the telehealth and testing. How do you hope that that's going to make a difference? If a kid is sick or a teacher's sick, they don't even have to leave the campus to get checked out? Walk me through that, if you could.
Well, I'm gonna let both of these two give you some specifics, but in terms of the telehealth, that's going to open up opportunities for kids that are on campus to get those services. With respect to testing on teachers, the testing is not going to be occurring on campus because that would be disruptive. Although there are many campuses that have school nurses, et cetera, that do have the ability to do testing, and some of that is going on. What we're doing is we're setting up, working with Dr. Dobbs, the opportunity for any teacher to get tested, first of all and immediately at the testing site here in Jackson on West Street that is already set up. Secondly, as we roll out this phase, you can also get tested at any of the mobile sites that the Department of Health and the Mississippi National Guard put out, and we do 2 different testing sites every single day. And then thirdly, as we come more online, and Dr. Dobbs can give you exact dates. But what we're going to have is 16 testing teams that will rotate in the various health department facilities throughout Mississippi. So once we get those 16 teams online, then individual teachers will be able to drive through a mobile testing site set up at the health department to make that a reality. So Drew, I don't know if you want to talk a little bit about any specifics or not, but on the telehealth side.
Yeah, sure. With the children, one of the things from the safety perspective is it makes access virtual. It allows the healthcare providers to provide services virtually a lot easier than it did before. And if your question is COVID related, well, the schools are going to have their own COVID policies, but the chronic care needs of children haven't stopped during the pandemic. And I think with the telehealth policy, with mental health services in particular, it is going to have a big benefit on allowing the students who have those chronic needs to stay in the classroom, and it doesn't put that additional burden on the parent.
And I will just say the mental health side, when we talk about the public health risk of kids not being in school, the mental health side is one, and we've highlighted that multiple times with various people that have come to these press conferences. It's one that is really concerning to me, and I know concerning to everyone else across this state. It's been a real challenge. And so, as I mentioned last week, the fact is that when you look at child abuse claims, you look at child abuse reports, you look at sexual abuse reports, they're down, way down in this country. And in large part, they're down because many of our kids are not in school, because that's where a lot of our kids report those things, because their teachers are who they trust or their administrators are who they trust. And so we've got to work through all of those issues, but this is just one tool to be able to do that. Did I miss anything on the testing side? Okay. Good. Yes, sir.
Thank you. Dr. Dobbs, two questions. One real quick. How many students, again, are in quarantine? And when it comes to the testing, how long is it going to take for these teachers to get a result? And if once they do get tested, even if they're not showing symptoms, does that mean they go home for the day, or can they still keep working until the test results come back?
Yeah, no, thank you. The number of students on quarantine currently are 2,035. And then as far as like the testing goes, it'll be going through the state public health lab. We have every anticipation that it'll be within that 24 to 48 hour turnaround period we have now. Obviously, if we have overwhelming demand, we might have to make some adjustments and recruit some other testing capacity. We do have some backups lined up already. But as far as requiring to be quarantined, if you're just getting tested just to get tested, you don't have to quarantine. But if you are symptomatic, then you do need to quarantine, or you need to isolate, until you get your result back. Or if you're an exposed person to a case, you should be on quarantine anyway. And then so you would obviously be quarantined. So if you're asymptomatic and just getting tested because you want to get tested, then you would not have to quarantine. We recognize that teachers and school staff are true heroes right now, trying to educate our kids in the midst of the largest, most impactful pandemic in over a century. And so the governor, and I thought it was a fantastic idea, and we support making sure that all teachers and all staff have ready access to quick turnaround lab results for all that they're doing for us.
Dave Elliott with WO Access Question.
Thank you, Renee. I'd like to request a follow-up, if I may, with Dr. Dobbs. Governor, you've been asked this 100 times over the last few months. Blatant violations of your executive orders regarding social distancing, face mask mandates, large gatherings. You've said local law enforcement have authority. Well, there's an RV park down in Hancock County. They've been holding concerts. Thousands of people say they plan more. County officials and the sheriff say their hands are tied because of loopholes in your orders. What's your advice on how this should be handled locally, and what would you say to the promoters of this event?
Yeah, I'm not familiar with the specific events that you're talking about, but I will certainly look into it. I will say this about Hancock County, and I will tell you their local leaders have done remarkable work. When I look at their total number of cases, both in terms of total number of cases through the 6 months of this pandemic, as well as when you look at how well they have performed, it's because their local leadership and I've met with them 3 or 4 times. Their local leadership, the board of supervisors, their mayors, they have done tremendous work, and particularly when you consider how close they are to the city of New Orleans and how much the spread occurred first in the city of New Orleans in March and April, and then in the last 2 or 3 months, how much spread occurred in the other parishes throughout Louisiana. Hancock County has really done well. I'll look into that specific event, and I'll look into what loopholes they are talking about, and we'll do everything we can to help them close them. We certainly don't need concerts with thousands and thousands and thousands of people ignoring the orders, because if that occurs, eventually there will be somebody at one of those concerts that has a virus that is a super spreader, and it will lead to major outbreaks. And that's not a record that we're interested in having. So I'll definitely look into that.
Thank you, Governor. Dr. Dobbs, we've seen a familiar pattern. You reopen the economy, 2 weeks later, numbers go up. Memorial Day, July 4th, numbers go up. Summer travel, numbers go up. Always a reaction to action. We're going in the right direction now, but since schools have restarted, if this pattern is consistent, do you fear positive cases will climb again in the next 10 days or 2 weeks?
Of course, we're very, very concerned about that. I would say that the impetus for educating our kids is certainly a very important thing. As a society, we need to educate our kids, and so it's something we need to work hard for. I mean, vacations and parties, I think, like we had over the summers, were really unnecessary and caused us a lot of unnecessary grief. We've worked hard with the schools. They've really been great as far as communicating with us, doing everything they can to prevent transmission. Within the schools, I'm actually less afraid than I am outside the schools and in the community where people are doing things that are sociable. So I would like to advise everybody to not do unnecessary things. I would like to advise, especially in the college area, that's actually what worries me more than anything right now, because these young kids are excited to be back around their friends, and it's going to be hard for them to not do that. But we know it's a recipe for disaster. So, we are really worried about it. We're going to watch it super closely, understand the necessity of doing some of these things, and hopefully combination of planning and good judgment will keep us from repeating the same pattern we've seen.
And what I would say is, and I think this is important, the best way to limit the spread of the coronavirus in our K through 12 schools is to limit the spread in our communities that then ultimately ends up in our schools. And so most of the cases that we're talking about now, and most of the isolation, or the students that are in isolation today, and again, we're doing more and more research every single hour of every single day. But as we do more research, what we're finding is more and more of that is out in the community. They caught it, kids caught it, and brought it into the schools. Much more so at this point. Of course, that's what you would expect, right? Is we're early, we're only a couple of weeks in. But most of the people that are on that list are people that actually caught the virus out in the community. And so the best way for us to limit the spread and ensure that schools can continue is to reduce the spread in the community. The best way for us to reduce the spread in the community is doing what we've done for the last 4 weeks, 5 weeks, 6 weeks in some areas, and that is wear a mask, stay socially distanced, and don't spread the virus because you have big social gatherings that you shouldn't be having because they don't meet the guidelines. So that's the deal. So, see, did you have a question on it?
Yeah, I did, Governor. Thank you. And this may be one for you, Drew. I know you'd mentioned the potential as far as children that would be able to have access to this telehealth through this increase, this initiative. Can you ballpark how many school districts this would be useful for? In other words, the number of percentages maybe or the percentage of districts that don't have school nurses or don't have these clinics, as far as kind of help us see the impact there?
That's a good question. I asked that this morning, and the answer I got was slightly more than half.
So we have 140 districts approximately, and we have about 1,100 campuses. So to put it in perspective, it's slightly more than half. That's 550 to 600 campuses, approximately. Yes, sir.
Thank you, Governor. So you opened up when you first sat down that Florida is scheduled to play Ole Miss. That does sound exciting for me too. You have stated in the past, though, that it should be the college's decision about player safety on the field, but the government's decision about fans in the stands. So when you just talk about social gatherings, I'd like to know, does your administration have a plan yet for how stadiums can pack? Will it be half capacity? And do you have any ways of enforcing large block parties or gatherings at the bars? If they can't go watch the game in person, they may hold their tailgates.
Yeah, so that's a great question. I have personally had meetings with many of our university leaders. I know Dr. Dobbs has had individual conversations with them as well. We are going to make a joint decision here, or I'll make the decision in consultation with Dr. Dobbs, as we've done on every single decision throughout the way. The universities have gotten together, and they have, after our conversations, they have proposals that we are reviewing. At least with the two SEC schools, those first games are not until September 26th. But we know that some of the other colleges are getting ready to play sooner than that. We got our order in place last week for high school sports for both MAIS and MHSAA. And so what I would tell you is, if your question is, do I have a plan that I'm ready to announce today? No. Are we 90% of the way towards having a plan that we can announce very, very soon? Yes. So those conversations are happening. So it'll be in the next week or so. We'll announce a plan as to what capacity limitations can mean. Because keep in mind, a lot of conferences have already said they're not going to play. And the fact that a lot of conferences have said that they're not going to play, that lends me to believe that for those conferences that do decide to play, there's going to be a lot of TV opportunities. There's going to be a lot of opportunities for those games to be on TV. And we're going to limit crowd size. You're not going to see a stadium in the fall in Mississippi that has 100% capacity. It's just not realistic. But if we'll do the little things over the next 2 or 3 weeks, if we'll continue wearing a mask, if we will be as vigilant for the next 2 or 3 weeks between now and Labor Day as we have been for the last 5 or 6 weeks, we're going to drive that community spread down considerably. And the numbers like we saw today of less than 300 cases, by the way, today's number, just for those of you who are keeping score, today's number of new cases was the lowest Monday since May. The lowest Monday since May. Now, we can celebrate that fact and say, look, what we're doing is working. Now let's do it even more. Let's double down. Let's try harder. Or we can say, well, we've accomplished it. Wrong. That's the wrong way to do it. What we should be doing now is saying, hey, we got a chance. We've gone from 9,100 weekly cases to half that many over the last 3 weeks. Now, if we could go from where we are today and cut that in half again over the next couple of weeks, then we can say, okay, we've made real progress. Now let's see what we've got to do to continue driving down the numbers. That is our goal, and that's what we've got to focus on.
I was wondering, Governor, could you talk about the positive trend of what appears to be? Even half capacity at Ole Miss's stadium is 30,000 people in the seats. That seems to be a recipe for a problem if you get one active spreader in there.
Half capacity is highly unlikely. As in, half capacity is not going to happen. It's going to be something less than that.
And regarding testing, like high school athletes, we see some districts are going forward, some have already canceled for the season. Do we start testing high school athletes, making sure that when they go on the field, they're not contagious, for lack of a better description?
Yeah, I don't know that we are looking at testing high school athletes, mandatory testing, if you will. They're doing some of that at the collegiate level. It's a decision made by either the conferences or the individual schools as to exactly how often. In fact, I saw earlier that at least in the Southeastern Conference, they haven't even determined exactly how many weekly tests they're going to provide. But there's significant cost associated with that. And so I think, what we tried to do over the last 4 or 5 days as we talked with Dr. Dobbs and his team is what can we do to make sure that we're protecting as many people as possible. We think the first step is offering teachers the opportunity to get free testing done at any time, whether they have symptoms or not. We think that's important. We also think that we will catch some asymptomatic individuals if, in fact, this is something that teachers would like for us to do. It's not mandatory. We're not making them do it. We're offering it to them. Another mechanism whereby they can have the opportunity to feel safe and understand what they're dealing with. Renee?
Leah Wellingham with the Associated Press has a question.
Thank you, Renee. Governor, yesterday when you were on Face the Nation, you were asked whether or not you are confident that all mail-in ballots in the state of Mississippi will be counted during the election in November. And you said the ballots that are legally cast in the state of Mississippi will be counted. Can you expand on what you mean by that? Are you anticipating some type of big cheating effort by Democrats or anyone for that matter in November?
Well, thank you for that question. What I said was that I believe that every ballot legally cast in the state of Mississippi in November will be counted. And what I simply meant by that, and I understand it's kind of the neat thing to do amongst the national media now to focus on this fight about the U.S. Postal Service and to attack President Trump because he's opposed to mail-in voting, universal mail-in voting. I simply meant that Mississippi has election laws, and I anticipate that those election laws will be followed. Nothing more, nothing less. If you legally cast a ballot in the state of Mississippi under the laws of our state, I have every belief that our circuit clerks, along with our Secretary of State and our state elections board, will count every ballot that is legally cast. I'm not anticipating some large effort in our state for voter fraud, but I also know that there is voter fraud in every single election that we have, and that we've got to be diligent in ensuring that we uphold the laws of the state of Mississippi.
Erica Hensley with Mississippi Today has a question.
Yeah, thanks, Renee. I've got a question for Governor Reeves and then a follow-up for Dr. Dobbs. Governor, you mentioned in previous weeks that the White House task force had a different methodology for looking at the positivity rate that might be a little more accurate due to using only to certain clinics that were reliably reporting both positive and negative. Do you have an update from them on the latest Mississippi positivity rate from their reporting?
Oh, thank you for that question, Erica. And sadly, I do not today, but I anticipate having one tomorrow. Typically, we get those weekly reports on Monday mornings because typically we do a call with the coronavirus task force on Monday afternoons. We did not do a call today. I believe we have one scheduled for tomorrow. But just as soon as I get that data emailed to me, I will certainly talk about it. As you'll recall, we were at about 15% test positivity 3 weeks ago. We were at about 13.5% 2 weeks ago. And so as soon as I get last week's number, I'll get it to you.
Great, thanks. And Dr. Dobbs, I haven't heard us talk about this in a while, so I just wanted to touch base with you. Is the health department tracking healthcare workers, the number of healthcare workers who've contracted COVID or died from it? I know we talked about it early on, but just wasn't sure if A, y'all were tracking that, and B, if there was, an update or an estimate.
We do have employment as one of our values on our contact tracing. So we can look at that again, and I will say that I expect it to be a lot easier to get a hold of as we go forward, in part because our investigations will be a lot easier to go in depth with only having to do 230 or so versus 1,700, right? So a little bit different sort of order of magnitude. But also we have our new surveillance software up and running. So I don't have any updates, but I think it's something we can get.
Yes.
Thank you. Dr. Dobbs, this is a question for you that a colleague of mine is wondering. Is there any chance across the state that there may be counties or other places that are not reporting all of their positive cases to the State Department of Health? Can you confirm that? And either way, how do you guys get your results to make sure you have everything you need?
From the schools or in general?
I guess both in general, but also
Okay.
the schools if you may.
Well, for the schools, they have, each school will designate someone to responsible for weekly reporting. We have a very easy format as far as like data entry. It's a simple web form, and we get it right away. But we're making sure that our investigation teams focus on school-age kids and college-age kids, because we know that's our major vulnerability. So we'll have basically a backup as far as like tracking students. Now, on the other thing about general reporting, if it goes through a lab, we feel very confident we're getting all of those, because the reference labs are really attuned to doing that. And we get electronic feeds from the major ones, and we're trying to build electronic feeds with some of the smaller new guys. We're adding dozens of new labs to our electronic feed, so we feel good about that, both for the positives and the negatives, which speaks a little bit to the survey, the mechanism of the positivity that we're getting from the White House uses more of that sort of feed. But as far as like the rapid test is a real vulnerability, we're not getting any negatives reported on the rapid tests. So it does undermine our denominator a little bit. We're actually having a little bit of trouble getting the positives from the rapids, and we continue to work with our doctors to make sure we report that. It's a little bit more labor intensive, but it's something that we have to have.
Why do you feel like that there are problems with rapid tests, why you wouldn't get any negatives? What are you finding behind there?
It's a manual process, right? So the reporting labs have electronic feed, so it pulls directly from their systems and comes right to us. For the rapid tests, it requires a nurse, an aide, a clerical person to go in there and enter it in each individual time. And so what we found is that that's not happening, and we're having to constantly reinforce with the clinics to make sure they understand the importance. Some clinics, not all of them, but some clinics.
Y'all have heard me say this a lot, and I'm going to say it again. We do look at test positivity, and we look at it primarily through the White House numbers, because they have a constant number of providers that are constantly providing that information to them. And we readily admit it is not 100% of providers. We think it's between 43 and 50% of all providers. But if you have a constant number in the denominator, and then it's just your numerator changes, it gives you a better understanding of directional movements of test positivity. I believe, I'm not speaking for anybody else, I believe that test positivity rates, and by the way, I've told Dr. Dobbs this, I've told Dr. Burks this, and everyone can believe what they want, but my personal view is test positivity, when taking in context with all the other data we get, is an important number. But if you take test positivity and pull it out and say, this is the only thing that matters, I would submit to you that is a flawed approach. So test positivity matters in the context of every other data point that you have. Yes, sir.
Governor, I wanted to go back to something that Leah had asked earlier about voting. There is a way to vote absentee, but you have to prove you're legally disabled, from what I understand. If people are incapacitated from COVID, what measure would be used to determine that they fit that criteria? And I've got a follow-up after that.
Well, you've got a number of ways. Number one, if you're over the age of 65, you can absentee ballot in Mississippi. 45 days. If you're over the age of 65, you can absentee ballot. No questions asked. Absentee ballot. If you have received a positive COVID test and therefore have more or less the response from a physician with respect to that, then that is a reason for you to be able to absentee ballot, take an absentee vote. But just simply saying, I don't want to go vote in person this year is not a reason. And so that's kind of the distinction. But again, if you're over 65, we know that the most vulnerable population of those with COVID and those that are most susceptible to it are those over the age of 65. And so that is certainly, I think, the most important area in which we can focus our attention. But there are other mechanisms by which one can absentee vote in our state as prescribed under state statute, some of which were relaxed a bit during the legislative session. And so I believe that we have a system in place in which everybody can vote safely in November. And again, keep in mind, today is August. This is going to be in November. But also keep in mind, in our state over the last 3 months, we've had multiple elections. Multiple elections have taken place in lots of different jurisdictions, and they have all, to my knowledge, gone off with very minimal challenges. We need to make sure that all of our poll workers have PPE. We need to make sure they all have masks. We need to do those little things. We need to make sure that everybody comes to vote, assuming we are in November where we are today, wear a mask. But if we do that and we maintain social distancing, we can run an election in such a way in which it is fair and it is responsible and that everyone can vote safely and everyone can vote for whomever they would like to vote for, and on election night we're going to determine a winner and we're going to determine a loser, just like we've done for the last hundreds of years.
Do you think, this is the follow-up, do you think that any of those measures that pertain to COVID are there concerns that might discourage older African Americans from voting?
I don't see any reason why it would discourage older African Americans from voting, just like I don't see any reason why it would discourage older white Americans or white Mississippians from voting. We want to create an environment where everyone has an opportunity to vote, and we strongly encourage them to do so. Now, we certainly will set it up such that their poll workers in all the precincts throughout the state have masks. We want to set it up such that we have perhaps take minor steps like putting tape on the floor. I don't know how many of y'all went to the grocery store back early on, and in many instances it's still the case where you have tape on the floor where if you are in line to pay, you have to stay this far away from the person in front of you, which again maintains that social distancing. We may need to do that. We need to do those little things at some of these precincts that get very, very busy at times. Mississippi has approximately 2,000 precincts situated throughout the entire state. And so we want to encourage everyone to show up on Election Day and vote for the candidate of their choice. We've got the Democrat National Convention, I believe, is starting tonight. I know the Republican National Convention will be starting one day next week. We've got a Democrat nominee, we've got a Republican nominee, we've got a system in place where we can vote safely in our state, and we'll see who wins when all the votes are counted in after the first Tuesday, after the first Monday in November.
Jackie with WHBQ has a question.
Hello. So is there a possibility that you would provide the same type of testing for students that you are now providing to teachers? And what about other staff members? Would they be allowed to get the same access to testing, if not now, in the future? And I have a follow-up question.
Sure. We are starting by giving teachers an opportunity to free testing. Keep in mind that every single kid, every single Mississippian that has symptoms has the ability to go to their local doctor, their local FQHC, their local lab if they have symptoms to get tests. And so we're certainly looking at ways to expand testing, and as the total amount of supplies and particularly rapid test improves, we're looking at ways in which to expand our testing options. But our initial steps will be to give the access to free testing to our teachers to provide peace of mind in many instances.
Okay, and over in Tennessee, in the Memphis area, schools are starting to use pool testing. Would you consider something like this for Mississippi, basically where they take a test from a group and depending on whether it's positive or not, they'll do retesting?
Right. I'm going to let Dr. Dobbs, he and I have had many, many conversations about pool testing for 6 months now. I'll let him jump in and answer that. He's more equipped to do so.
There are certain circumstances where that makes a lot of sense. When you're trying to save lab reagents is really the purpose of it. If you have a certain percentage positivity, it's actually more labor intensive to do pool testing than individual testing, probably around 15% or so. You actually spend more effort and time because you have to repeat tests. It does make sense in certain scenarios that we've looked at, maybe household testing, where you basically can treat the whole household almost like as a unit. We haven't seen any practicality for doing it for routine screening at this time, but certainly if we have reagent issues where that becomes more valuable than person time, we could consider doing that.
And just so everyone back home understands, when he talks about the potential for pool testing for those who live in one household, the reason for that is we've seen a lot of transmission occur in what we call communal living, and we also know that if there's a family of 4, if one of them has it for a few days, 3 days, 4 days, in a household, the likelihood that everyone else has it is relatively high. And so it's one of the reasons that you hear us talk about, when we talk about self-isolating or quarantining, if someone in your house that you live with has it, the likelihood that you are not going to get it is not that high, and the likelihood that you are going to get it is relatively high, again, on the margin compared to everyone else. So, yes, sir.
Thank you, Governor. I'd like to go back to House Bill 1806, if I may. So last year, I did a story with State Auditor Shad White. He found that there was a lot of misspending over the years, a lot would say, at the Department of Education when it came to administrators and other departments, getting a lot of money, and teachers always got the short end of the stick. He found that they missed out on an $11,000 pay raise if you redistributed things properly. So in this bill with the $28 million, can you give me any specifics? How does this money specifically go to teachers, those who are really making the difference for kids' educations? And can you tell me how it's going to be distributed to the 23,000?
Thank you. That is a great question, and I think it's critically important. One of the things that we've seen in Mississippi over the last I guess since the beginning of time, is that we've seen increases in spending at the administrative level go up at a much higher rate than increases in teacher pay. And so that's one of the reasons that I was so adamant about making sure that this program, this $28 million, was funded, because this entire $28 million goes to teachers. It goes on a school-by-school basis based upon whether or not if you are an A school, a B school, or if you have improved a letter grade, then this money comes to the teachers at that particular school, and then it is delved out by usually a group of individuals that are selected by the teachers at that school, who then decide exactly how it goes out. And so there's no doubt that the state auditor's report showed that administrative spending rises, or at least has risen at a level faster than teacher pay. I believe if we're going to increase spending at the K through 12 level, we should do it in such a way that we put more money in the classroom and less money in the district office. That's what I believe is a formula for success. I've been working hard for the last 9 years to make that happen, and I'm hopeful that we can get continued support by our Republican-led legislature, and I hope that they believe that too.
So none of this is going to go to the state superintendent, who's currently making more than $300,000 a year, to add to her salary?
100% of this $28 million is going to teachers in the classroom. The reason I vetoed the bill originally is because I believe that this $28 million, which would have basically been a teacher pay cut had they not funded it, because this is money that these teachers had earned because of the quality of their ratings in their schools. It's the reason, one of the reasons we rate schools, right, is parents need to know, is my kid going to an A-rated school, or is my kid going to a D or an F-rated school? Because everybody in Mississippi knows what it means to get an F, and everybody in Mississippi knows what it means to get an A. And so I think that we've got to continue to raise the level of expectations. We've got tremendous teachers that are dedicated all over the state of Mississippi, and we need to reward success in our educational system, just like we reward success in our economy. Yes, sir.
Hey, Governor, are you going to be watching the Democratic National Convention that kicked off today, any this week, and then what are your thoughts on the upcoming Republican National Convention?
Well, thank you for that question. I don't know. I'm a pretty busy guy right now, and so I don't think I'll spend a lot of time watching the Democrats. I'm pretty sure I know what they're for, and when Former Vice President Biden picked the former Attorney General and the current United States Senator from the state of California. I think he made it very clear the direction he wants to take his party. He wants to move the Democrat Party as far to the left as is possible. Certainly his prerogative, but I also think I know what that means for America, so I don't think I'll spend a lot of time doing that. I do plan to participate in activities at the Republican National Convention. I will lead the delegation as is customary for the governor to do so. I will deliver our electoral votes for the nomination of the presidency to our incumbent president, to President Trump, and look forward to having the opportunity to do that next week.
Hunter Jonkins with the Gazebo Gazette has a question.
Thank you, Renee. Thank you, Governor. Governor, I have two questions for you. The first one is the CMR has their monthly meeting tomorrow morning. And at the last meeting in July, it was a lot of unsurety from the commissioners about what steps they could take and what they could do. And I know there's been a lot of passe movements through the media and through yourself in the press conference about what actions are what. But the end of the first question would be, can you answer where they need to look at, what they need to follow? They need to follow an Attorney General's opinion, or they need to follow what the executive order that you put out is? And the second question is, can you give us in the media a follow-up of where we stand in the unemployment trust fund? Thank you, Governor.
Thank you, Hunter. I appreciate those questions. My advice to members of the Commission on Marine Resources is to get on the phone and call your House members on the coast and ask them to fund the agency in a manner similar to the way in which they funded it for the last 15 years when Go Mesa came into existence. And so we're having conversations with leaders in both chambers, and we will continue to do so. I'm hopeful that we can find an opportunity to get that done. We know that we are running up on a deadline at some point in the very near future, but I do plan to continue to have conversations and try to break the logjam between the House and the Senate. We are having productive meetings, productive conversations, and I hope we're able to convince the House to fund Department of Marine Resources again in the same way that they've been funded for the last 15 years. And with respect to the Unemployment Trust Fund, I don't have the exact numbers in front of me. You'll recall from last week, we started this, I'll just call it what it is. We started this nightmare of 2020 with approximately $710 million in the trust fund. It got down to approximately $310 million. We asked the legislature for $500 million of CARES Act funds. They gave the department $180 million, so that went up to about $490 million. That's been 2 weeks ago that was funded, and so we spend between $21 and $23 million a week, and so back of the envelope math, we probably have somewhere between $400 and $450 million left in the trust fund, with a burn rate right now between $21 and $23 million.
Bobby Harrison, Mississippi Today, has a question.
Hey, Governor, going back to the elections, arguably Mississippi has it's more difficult to vote absentee in Mississippi than any state in the nation. I mean, to vote by mail, you have to get not one but two signatures in front of a notary. Do you support Mississippi having the most difficult voting laws in the nation when we have such a history of denying people the right to vote? I mean, would you like to see it made easier to vote absentee in the state like it is in most other states?
Well, thank you, Bobby. I've got to admit I'm not an expert on the election laws of the other 49 states, but I am comfortable Mississippi's election laws that have allowed us to execute execute elections over so many years are adequate at this time during the middle of a pandemic. I think we can have a safe and fair election in November, and I look forward to the state doing exactly that. Seeing no further questions, one more.
I'm sorry, Governor.
That's okay.
I apologize. I do have a question about what we talked about earlier, and this may be more for Dr. Dobbs, but as we get closer to these college football, these events, and as you already mentioned, there have been photographs circulating around of a lot of different things happening in Starkville, particularly over the weekend with college students coming back. What about the status of being able to provide information on positive cases within that area? I know a while back you talked about helping universities with that because the state goes by county of residence, and so you wouldn't necessarily see a spike in Lafayette or Tillahaw for these purposes. And also, too, at what point do you think that might be made public where we would be able to see it, versus just the universities?
Yeah, no, that's a good question. And certainly, we're obviously very concerned about it, so we're refocusing our investigation teams to look at student-age kids and college age. We also will be able to look at by clinic location. One of the things I'm just saying, it's just so very important. Clinics out there, please complete the information, because if we don't get complete information, it really does slow down the process, as you can imagine. So if we have good information to start with, it makes this situation so much more efficient. So yes, I believe we could make that information available as well.
Seeing no further questions, I will just point out the 18 to 29 age group has almost 16,000 confirmed cases, and the next closest age group has less than 11. And so I want to urge our community leaders in and around college campuses to work diligently. Let us know if we can be helpful with respect to that. It is going to be a significant piece of the puzzle to making sure that we can do the things that we want to do this fall, is that we make sure that spread does not occur in those areas. So please be diligent, be vigilant, and we will work with you to do everything we can to slow the spread. Thank y'all. Stay safe out there, Mississippi. God bless.